So my oral presentation is on Manitoba's opioid crisis, so I'm going to give you an overview which includes my introduction and goals, what are opioids, findings, ideas, examples of successful supervised injection sites, conclusion, and my bibliography. So my introduction and goals, so my name is Sabrina. So in recent years, news media outlets have been casting more coverage on Manitoba's opioid crisis. Having the University of Winnipeg downtown, a lot of students can probably share a story of walking to class and seeing someone hooked up on some type of narcotic. With the media coverage of opioid crisis always being publicized, we wonder, how bad is the crisis? Is there really a crisis, or is media just blowing out of proportion? So my goal is to provide the audience with information, statistics, and the idea of having a supervised injection sites with the opioid crisis in Manitoba. So what are opioids? So opioids are described as a class of drugs that include heroin, synthetic opioids such as fentanyl, pain relievers, oxycodone, codeine, morphine, etc. When used, they interact with opioid receptors in the nervous system in the body and brain and gives an individual sense of pain relief and also produces a sense of euphoria. So my findings. So you can actually see these pictures, but I'm going to try and post this slide into the group so you can actually see it. So Canadians are the second highest consumer per capita of opioids in the world. The United States is currently first. So these pictures show us a glimpse of the opioid-related deaths across Canada from 2016 to 2017. The one below actually shows both opioids including fentanyl and fentanyl deaths only, showing an increasing trend in Manitoba. And then my other picture is a 2018 report of the opioid deaths across Canada. Unfortunately, Manitoba did not give any data for the 3-month period. So my idea is to have supervised injection sites. So supervised injection sites are a way of reducing infections. Eradicating the opioid addictions overnight is not feasible, but providing individuals with information and tools to prevent the spread of the infections such as HIV and hepatitis C are ways of combating the crisis. In the City of Philadelphia Review of Evidence on CIS, which is the supervised injection sites, shows that Canada's Insight Clinic in Vancouver demonstrated it prevented more than 80 HIV infections annually, which results in an estimated annual savings of almost $13.7 million in HIV medical care alone. Similarly, in Spain, the rates of the new HIV infections have decreased from 19% in 2004 to 8.2% in 2008. In the hypothetical CIS in Montreal, it showed that each additional site would prevent 11 cases of HIV and 65 cases of hepatitis C annually. So reduction in death from overdose. So in a study at the Insight facility in Vancouver, a study on the pre and post mortality rate found that a 35% reduction in mortality within the 500 meters of the facility in its 3 years of opening. A similar report from Spain demonstrates the reduction by almost half within a decade from 1,833 in 1991 to 773 by 2008. So there's actually another picture here. Unfortunately, you can't see it, but it's talking about the cost effective of operating. So this picture is a descriptive statistic from the City of Philadelphia. It shows us a breakdown of the cost for one person being admitted to the hospital for an opioid overdose, as well as the interactions associated with opioids such as HIV, hepatitis C, and skin and soft skin tissue. Supervised injection sites reduce those costs greatly. Trained professionals that are equipped with naloxone, which is the altering effects for fentanyl, are on the guard at the facilities to prevent any overdosing deaths, resulting in no need for an ambulance call, ER visit, or staying in the hospital. A review of the report of an EPI report released in 2017 by the government of Manitoba, the opioid crisis in Manitoba has been creating a backlog of services for Winnipeggers. Essential services such as the fire paramedics and hospitals are having to be used to treat opioid overdoses. In 2015-2016, there were 131 hospitalizations for opioid poisonings. The ICU, which is the intensive care unit, admissions were almost doubled in 2015 at 23 cases, and 2009 admissions at 12 cases. Emergency response crew were called 63.3% of the time in Winnipeg Regional Health Authority to administer naloxone. So, example of successful supervised injection sites. So in a Toronto report, researchers have found in an Australian study that supervised injection sites have decreased in drug-related crimes, public drug use, and loitering. In Vancouver, where a supervised injection site operates, indicates that there has been no increases in crime and actually has seen a decrease in petty crimes such as car break-in and thefts in the neighborhood. Dr. Thomas Kurt at the BC Centre for Excellence in HIV/AIDS says that since opening the Insite in Vancouver, their infection rates are the lowest in Canada. Previously, they were the highest. He goes on to mention that overdose deaths around the facility have dropped by 35%. Also, people who regularly use the Insite facility are 30% more likely to enter an addictions treatment. So is it really that bad, or is it the media? The statistics do not lie. So in a 2-year period, with the death rates of all of Canada for opioid deaths have gone up from 3,005 in 2016 to 3,996 in 2017. Although some provinces saw a slight decrease, some provinces such as British Columbia, Manitoba, Ontario, and Alberta are still facing high death rates. The media is doing the job of making Manitobans more aware of what is happening statistically with the opioid crisis. I believe the more the media pushes the statistics on Manitobans, the more they will question the need for supervised injection sites for the safety of everyone. The opioid crisis will not disappear. The Manitoba government needs to push Manitoba needs to pressure the Pallister government into addressing the need for supervised injection sites instead of overlooking the situation and slashing funds for necessary programs to help addictions. And thank you for listening.